Hi everybody, welcome to my YouTube channel Dr.Sreenivas Medical Concepts and my FB page Dr. Sreenivas Concepts. This is Dr. Sreenivas, a neurologist from Rajahmundry, Andhra Pradesh, India. My email is sreeklpm@gmail.com. I am also the medical author of the two books Focused Neurology and Exam Oriented Clinical Neurology. We are continuing with the neuroimaging concepts. We are talking about the spinal cord disorders. So today we'll discuss the structural disorders of the spinal cord. So neuroimaging concepts, part 37, spinal cord disorders, part 5, structural disorders. The structural disorders of the spinal cord could be due to the cervical spondylosis. It could be because of the degenerative changes or because of the disc herniation, or it could be because of Syringomyelia, which could be because of trauma or Arnold-Chiari malformation. So the structural disorders of the spinal cord could be due to cervical spondylosis or Syringomyelia. So about the structural disorders of the spinal cord, cervical spondylosis or the disc herniation, we need to know about this anatomy. So here we have the disc. This is the disc and this is the spinal cord. The central part is the gray matter, the H-shaped one. From the dorsal horn, you get the dorsal root, joining the dorsal root ganglia. From the anterior horn cell, we get the ventral root, again coming out like this, going and joining the dorsal root and finally emerging as a spinal nerve. So we have the spinal cord, which is centrally placed, and in the spinal cord we have the centrally placed H-shaped gray matter containing the anterior horn cells, the ventral root, the dorsal horn, the dorsal root ganglia, and both of them join and as a mixed nerve. And here we have the disc. So generally the disc is localized to this particular territory, but when there is a herniation of the disc like this, when it comes out, usual location is this posterior lateral location, posterior and lateral location. So usually the disc herniation occurs in the posterior lateral side, and therefore it goes and compresses the dorsal root, and therefore patient will experience severe pain, a radicular type of pain. And the herniated disc, the disc herniation usually occurs in two regions, one in the cervical region, second in the lumbosacral region. Why it occurs only in these two regions, not common in thoracic region? Because we have excessive movement at the neck. We bend, we extend, we turn neck. Likewise at the lumbar region, we bend forwards, bend backwards, turn. Because of these excessive movements, degenerative changes occur and cervical spondylosis or disc herniation occurs. And second important, and thoracic region, we don't have much movements other than breathing. Therefore, there's hardly any degenerative changes because of this excessive movement. And second, the thoracic region is protected by the rib cage, and therefore a disc prolapse or disc herniation in the thoracic region is very uncommon. It is commonly seen in the cervical area and lumbosacral area because there's an excessive movement. And generally the disc location is posterior lateral, and therefore it usually affects the dorsal root, causing severe radicular pain, radicular type of pain. But sometimes the disc may herniate centrally. If it herniates centrally, it will affect the spinal cord per se and causes myelopathy, which is dangerous. It can cause motor involvement, can cause motor involvement. It can affect the sensory tracts, and if it is lower down, it can affect the bladder and can result in neurogenic bladder. Neurogenic bladder is one of the indications of surgery, and therefore when a disc herniation occurs, it usually occurs posterior laterally, wherein there is only dorsal root being affected, a radicular type of pain, or it could herniate centrally and affect the spinal cord, which is dangerous, and we have to be more cautious, probably needing neurosurgery if there is neurogenic bladder because of spinal cord involvement. So structural cause of spinal cord, two important causes. One is cervical spondylosis, second is the herniated disc. These are the important causes. So this is the cervical spondylosis. So here you can see this is the pons, this is the medulla, this is the cerebellum. So the spinal cord is coming like this. It's nice here, but here you can see the disc coming here. Here it is very, very thinned out. Spinal cord is very, very narrow, and then again it is normal. So this is the sagittal T2 MRI in a patient with symptomatic cervical spondylosis. The spinal cord is severely compressed at the C5-C6 intervertebral disc space. Faint abdominal T2 hypertensity of the spinal cord is seen at the site, can be seen at the point of compression. Following surgical decompression, patient's myelopathic symptoms partially improves. So this is the cervical spondylosis, very severe spondylotic changes, severely compressed at the C5-C6 spinal cord. So we have seen disc prolapse, we have seen spondylosis. The other important structural cause of spinal cord disorder is the Syringomyelia. So this is the sagittal T2 weight MRI showing the syrinx. So this is the syrinx. So syrinx is an intramedullary lesion. So the classic sign of Syringomyelia is dissociated sensory loss, because the posterior column does not cross at the level of the spinal cord. It goes, ascends and crosses at the level of the medulla oblongata, whereas the spinothalamic tract ascends one or two segments and immediately traverses the spinal cord, the gray matter, and then ascends to the opposite side. So when there's a lesion inside the spinal cord, an intramedullary lesion like Syringomyelia, it affects the traversing spinal cord but spares the posterior column. So the sensations carried by spinothalamic tract is affected, that is pain and temperature are lost, but sensations carried by posterior column, that is touch, position, joint, vibration sense, are spared. So this is known as dissociated sensory loss, very characteristic of Syringomyelia. Pain and temperature are lost, but touch, position, vibration sense are spared. So if you touch the patient, he may appreciate, but if he unknowingly keeps his hand in the burning fire, he'll not be able to appreciate because his pain sensations are affected. So very characteristic. Syringomyelia, dissociated sensory loss. Pain is affected, but touch is spared. There's a dissociation of sensory loss. So very characteristic of Syringomyelia. So this is another structural abnormality of the spinal cord. These are the structural abnormalities of the spinal cord concept. The other important concepts of clinical neurology I put in a book called Exam-Oriented Clinical Neurology. This book will be very useful for students appearing for clinical neurology exams. So if interested, this book could be purchased. The other book I've written is Focused Neurology. All the important points of neurology I put in a question and answer format. This book is available online from all leading booksellers, including Amazon. So if interested, this book could be purchased online from Amazon. This book will be very useful for students appearing for Viva OC exams, because all the theoretical points of neurology are put in a question and answer format. If you have enjoyed listening to these wonderful concepts of structural causes of spinal cord disease, please like and share the link. But please subscribe to my YouTube channel, Dr.Sreenivas Medical Concepts, which is India's leading neurology educational YouTube channel, and my FB page, Dr. Sreenivas Concepts. Thank you. Bye.